KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wirtz. It seems that we hear every day in the press of a mass shooting or other incidents of gun violence. In 2023 alone, the United States has surpassed 400 mass shootings, according to the Gun Violence Archive. To talk more about this topic, we're joined today by Dr. Jahan Fahimi. He's an emergency care physician at UCSF and medical director in the adult emergency department there. Thank you so much for joining us today, Dr. Fahimi.
Thanks for having me.
Tell us, please, why does gun violence seem to increase during the summer months?
Yeah, there's a lot of theories for why we see a spike in violent activity in the summer months. I think some of it has to do with, celebrations. People are outside, warmer weather, less congregation indoors, and there's just more opportunities for, sort of violent activity to occur. Also, you have, younger individuals out of school and less structured time, start to see an increase in violent activity.
Dr. Fahimi, can you tell us what is the most recent research shown as far as the epidemiology of gun violence?
Yeah, the epidemiology of gun violence is it's interesting because I think many times people consider it as one entity, as one thing that occurs in our society. But in the reality, it's multiple different phenomenon that are coming together that we lump together. And so while we oftentimes spend a lot of media attention on mass violence, that makes up about 1% of injuries and deaths that we see from gun violence nationally. The leading cause of deaths by firearms is suicide. I think the other big component is homicide deaths. What's interesting about the epidemiology there is that for many years, it was much more suicide deaths than homicide deaths when you're looking at firearms. And what we've seen over the last, 5 years or so is that those numbers are becoming closer together. And so what we're seeing is more violent activity with firearms, more homicide deaths, such that it's actually catching up to the number of suicide deaths annually.
And there's probably just a lot more guns out there that are being used, ghost guns and whatnot. What are some of the techniques and methods that UCSF is doing to prevent gun violence, if there's anything that can be done?
Yeah, I think there's a couple of things that UCSF has led the way in. Our affiliation with San Francisco General Hospital and the Wraparound Project, which is a hospital-based violence intervention program, is really trying to interrupt the cycle of violence that occurs in our community. And these programs, which exist in many major cities across the country, really aim to meet patients at the highest risk point in their lives when they found themselves in the hospital after an injury. And the goal is to prevent them from returning to the exact situation in the community that led them to be injured in the first place. And so I think UCSF's role in growing, developing, and disseminating the impacts and the research related to hospital-based violence intervention program is critical. The other piece I think that we do quite well is that we've really been on the forefront of leading how we integrate the topic of violence and the topic of firearm violence within medical school, nursing school curriculum. And so, when I went to medical school, we didn't really learn very much about guns. We didn't learn very much about violence in general as a medical phenomenon. And we're trying to flip that paradigm. We published a large consensus guideline that had stakeholders from multiple specialties, from nursing, from medical education. And what we really tried to do is say, what are the highest priority educational items that doctors and nurses and all healthcare workers need to know when they're out in practice. And the idea is that if we can train everybody to understand that firearm violence is within our wheelhouse. These are our patients. The causes of their injury and their illness are things that we can affect either before the injury happens or after the injury happens. And so slowly and but surely what we're seeing is that medical schools around the country, nursing schools, different professional societies are really starting to adopt this perspective. And I'm hoping that the next generations of doctors and nurses will really be well versed in this in a way that we can be, leaders in preventing gun violence from happening in the first place.
You bring up a great point, which is gun violence affects everybody. How does it particularly affect the healthcare team and those that support patients that have encountered gun violence?
Yeah, I think those of us who've worked in emergency rooms have spent many years witnessing the impact of community violence, and it's really tragic, particularly when you see younger individuals being injured. You see the relationship actually between violent acts in a particular community. When I did my residency, I was training in Oakland. You would see clustering of violent activities, and you got the sense that these things were related. There was a community connection between some of these acts. It can be quite demoralizing to witness this, to have to speak with family members after these incidents happen. And many practitioners really try and disconnect from the reality of what is happening in the community, because we have for a very long time felt very powerless to do anything about it. Fortunately, I think public sentiment has changed. The federal government's research priorities have changed. I think fortunately what we're seeing is more physicians and healthcare workers really kind of taking ownership of firearm injuries as part of what it is that we do in healthcare. We're seeing more, physician advocates really stepping up and trying to change the way we advocate for gun laws. We're seeing physician researchers doing the research that has been sorely needed for many years. We're seeing physician educators who are trying to educate the next generation of the healthcare workforce. And the goal is hopefully that the future doctors and nurses will be better equipped to handle firearm injuries within the healthcare realm.
Excellent information as we see more guns involved and becoming a part of a public health crisis. Thank you so much for joining us today, Dr. Fahimi.
Thanks so much for having me.
We've been joined today by Dr. Jahan Fahimi. He's an emergency care physician at UCSF and medical director in the adult emergency department at UCSF Health. My name's Alice Wirtz. You've been tuning in to As Prescribed. Thank you for joining us.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.